people, welcome to the Dr. Joy Show, your prescription for total wellness, and I am your host, Dr. Joy. Woo, do we have a good show today. We're going to talk about improving your self-image and your look without needles, knives, or downtime. It's a special procedure. It's called Ultherapy, but before we get started, of course, we're going to do our 3 deep breaths to take you down. Are you ready? On my count, inhale. Exhale. Inhale. Exhale. Last one. Inhale. Exhale. How do you feel? I feel great. How do you feel,
I feel relaxed.
Dr. Burnett?
Very relaxed.
I want to welcome Dr. C. Duncan Burnett of Burnett Plastic Surgery to the Dr. Joy Show. Thank you for joining me.
Thank you, Dr. Joy. It's so good being on your show today.
Yes, and you know what we're going to talk about? You know
I think we're going to talk about Ultherapy
Yes,
today.
we are going to talk about Ultherapy.
That should be great.
Yes, so what is it? What is Ultherapy?
So Ultherapy is an energy-based type of system that's used to lift and tone skin. It's also used for tightening the skin and the soft tissues around the face and neck, and sometimes a décolleté.
Really? Now, what technology is used?
This is based on ultrasound, and ultrasound technology has been used for many things, including medical imaging. So we've used it for physical therapy, medical imaging, but now it's a little different because it's focused micro ultrasound. So the energy waves are now directed more in a targeted fashion, and that's what allows the patients to have the results that they can get.
I mean, I know about ultrasound because I have 2 children, and you know they do the ultrasound in the beginning and during the pregnancy to see where the baby is. Is it kind of like the same where you have this instrument on the outside?
Right. It's called a transducer, and it's very similar to what one experiences during a pregnancy. What it's doing for us, though, in this particular circumstance, it allows us to see the tissue layers below the skin. Because what Ultherapy does is it targets the layer that we use during a facelift, which is the fibromuscular layer of the skin.
Okay.
So it's beyond skin, it's beyond the subcutaneous tissue and fat, but down to the fibromuscular layer, that's what we call it. And that's what's used to redrape portions of the face, portions of the forehead, and portions of the neck.
Okay. So now with the ultrasound, give me a typical day in the life of somebody that's getting this procedure. First of all, who's a good candidate for it?
Well, it's interesting. Many people are good candidates. It's based more on skin laxity, so it's not that we necessarily will put an age on the patient. However, if you look at the literature, it will say between your 20s and 30s, some patients come in, 40s to 50s, 60s to 70s. So you'll find that there's a big range of patients that the procedure is amenable to. But again, going back to laxity, facial aging really depends on how a person has treated their skin over the years. So what will happen is, that's right, what happens if you're exposed to sun too much and you haven't been protecting with something as simple as an SPF 30 with your sunscreen, you get solar damage, and that damage potentiates weakness of the collagen in the skin.
Okay, so what's the function of collagen now?
So the collagen kind of plumps us up. It's like the foundation of our skin.
Okay.
It minimizes our wrinkles if we have a good, strong lattice or network of collagen. And as we age, the collagen gets worn from just smiling, from talking, from chewing, from moving, from animation.
Just
generally.
life in general.
Life in general.
All right, so I heard you say something about sun exposure.
Right.
So are you saying that people should minimize sun exposure? Because we get natural vitamins from the sun.
Right, right. And there's a strong balance that we have to kind of figure with most patients. Vitamin D deficiency is very rampant these days, and I think it's because, particularly in the African American community, particularly there's not a lot of sun exposure that we get.
Right.
And there should be a balance. However, if you're overdoing it in the sun, if you're out in the sun for 3 or 4 hours during the height of the day, you can easily end up with solar damage, or solar elastosis as they call it, which damages the superficial layers of the skin and potentiates hyperpigmentation, potentiates wrinkling and things like that.
So if a person, and I just want to get it straight because I know a lot of people like the sun, all right?
Right.
So if they do sunbathe,
Right.
and they sunbathe during the times that are not recommended, even though they lather up with their sunscreen, can they still get this procedure done?
Oh, they can.
Okay.
They can. It doesn't preclude them from doing the procedure, but just from a general health standpoint, I think that patients should be cognizant of their exposure to the sun.
Okay.
So it's more that than anything.
All right. So is this surgery?
No, it's not. It's non-invasive. That's what makes it exciting. It's a facelift without having the surgery.
So
in a sense.
I know it's no needles, no knives, but the fact that it's a procedure, I had to ask, because some would say, well, no needles, no knives, no downtime, but are you putting me to sleep? Is the patient going to be...
Patient's awake. Patient's awake during the procedure.
Patient is awake?
And yes, and very few clinicians will do nerve blocks for the patient so that they can experience less discomfort with the procedure. There is some pain associated with the procedure, but there's a new protocol that they've come out with that has allowed us to use less energy to get the same result with our patients. So before we used to use a higher energy, 1.2 joules. Now we're down to 0.9 joules, and it's better tolerated.
Right.
Procedure takes a little longer. So before we could do the procedure in 60 to 90 minutes. Now it's usually 90 minutes to sometimes 2 hours to get a full face done.
I was going to ask, is that time span for a full face, or is it just one part?
Right, that's a full face. And you can break up the treatments into different segments of the face. So you can just do the eyes, which takes about 10-15 minutes maximum. The forehead may take 5 minutes to do. But when you're starting on the cheek level and the lower jawline and the neck, it takes much longer. There's a new protocol that they just came out with for isolated neck, because that's a problematic area for a lot of us. We want to see that angularity in the neck. And if we don't see that angularity, it's kind of associated with premature aging or aging generally. So we're trying to do what we can to prevent what gravity is doing to us. It's pulling everything down. We're trying to elevate everything.
And I know you're going to get to some before and after pictures, but I gotta keep asking my questions. How is Ultherapy different from other lasers?
Well, the lasers act at a different level, first of all. Ultherapy goes down to 4.5 centimeters. So that's 4.5 centimeters is a little deeper than you would see. I'm sorry, millimeters is a little deeper than you would see with your laser.
Okay.
The laser is usually about 1.5 millimeters.
Okay, so it's going real deep. It's deep penetration.
Right, and it's going down to deeper layers. So because it goes to the deeper layers, it's affecting the collagen at that level. If you use a laser, lasers vaporize, and usually lasers are a little hotter, about 100 degrees Celsius. So what will happen is the laser vaporizes the skin and causes what they term as ablation, removes this surface layer, allows you to develop new skin, so there's associated downtime.
Right.
With this particular procedure, everything is directed below the skin level. You heat up the collagen to a certain level. It's usually about 150 degrees Fahrenheit that is, and or 70 degrees Celsius, and that denatures the proteins of the collagen. And because it's broken down, it then builds itself up. So we see our results gradually. Usually it takes a couple of months to start to really see the effects.
Really? Now I know there's safety involved, so this has been tested, over 100,000?
It's FDA approved.
If it's FDA approved, woo! So it's FDA approved. Not to say that Dr. Joy is going to do it. No. I'm just putting it out there that it is a safe procedure to do. Okay,
Right.
because a lot of folks see things, and if it's not FDA approved, they go and do it anyway. So I just want to make sure, and we state that. All right. So now, good candidates. Is gender specific, age specific? You talked about the age, but gender specific, and what about ethnicity?
Interestingly, when it comes to gender, I find that men do really well, and I'm trying to figure what that is. I believe it may be because we shave every day, and we're used to having cell turnover just from shaving, and we have a lot of hair follicles in our lower neck and jawline.
Okay.
So I find that they respond really well. Women respond as well, but it's just different. You may see the results take slightly longer, maybe 2-3 weeks, a bit longer, but it's really variable. It depends on skin laxity. If a person has more lax skin, it may take more energy to do what we're trying to achieve, which is the elevation or resuspension of the neckline. We find that if we're doing a patient with extremely lax soft tissues, we may have to do 2 procedures, 2 sessions. Most times this can be done in 1 session.
So you could get 1 boost, and what does the 1 boost give you? If a person wanted to just do it once, what do they get? What's the result?
So once, and I'm going to say full face, meaning we do the entire face.
Yeah.
That person will get a brow elevation, which can be up to 2 centimeters, which is almost 1 inch.
Oh wow!
So brow elevation, which minimizes some of the hooding of the eye.
Right.
So that makes one's eyes more attractive.
Right.
You can do the lower lid to tighten up the crow's feet. You can elevate the cheek, and you'll see that in my before and afters, that the cheek gets repositioned a little higher, and by doing that, you also have re-elevation of the jowl area, which is a prominent area that is a telltale sign of aging, and we're able to resuspend that. Also, when we look at just the angularity of the neck, the recess behind the mandible or behind the jawline is better defined after the procedure, so it just gives one a more youthful look. I mean, the way we think about it is your skin fits your facial skeleton better.
Right.
So it's like it makes your face fit better on your skeleton. That's a very strange way to think of it, but that's what it does.
But it makes sense. And obviously, the person that's doing this, your patients, your clients, will feel better about themselves in terms, which will enhance their self-image, their self-confidence would probably like go through the roof, right?
Oh yeah.
Okay.
Oh, we see that.
So it's like, I'm big and bad now. See, look at me.
And I think, I agree. And one of the things I think that they really enjoy is that it's not. It doesn't happen right away. It's very subtle, and what happens is eventually people keep saying, you just keep looking better. What's going on in your life?
Like, what are you doing?
Yeah, what are you doing? Right.
What are you doing?
They don't think you had something done, but they think you look rested, you look more youthful, you just look like a better you. And that's an exciting prospect.
That is very exciting, and then internally that does something for them when they're getting the external validation and comments from others.
Absolutely, absolutely. So when we talk about the procedure, though, I do stress that it's not a pain-free procedure.
Okay.
But
how much pain are we talking about?
To the point that we give some muscle relaxants and benzodiazepines. These are medications that will help to sedate a person, like Valium.
Okay.
Just a little Valium, in addition to Motrin. The Motrin, we use a very high dose because that helps with just the pain that you experience. But the pain is it's limited. After the procedure, there's no pain. You just feel tenderness and tingling on your face, but you don't have soreness per se. You can develop some bruising after the procedure, but very rarely. That's why we try to be specific about our history to make sure our patients are not on any blood thinners or any agents that promote thinning of the blood, I should say, and can result in some bruising or echomosis.
Well, of course you're going to do an assessment, Doc. I call Dr. Burnett Doc because I've known him a while.
That's good.
So, but of course you're going to do an assessment, so you would make sure that they are qualified or have passed the assessment to do this procedure.
Absolutely.
Right. So now, target areas. Do most people just come in for a specific area, or do they do the whole face?
In my experience, it's been more the whole face, a full face treatment.
Yeah.
But they can come in for component treatment. So they can just do the eyes, or they could just do the brow if they're seeking that particular aesthetic. They can do the lower face, which doesn't include the lower lids and the brow or forehead. I think that it really is dependent on the patient's needs. So that's why when we do our consultation, we try to really figure out exactly what the patient is seeking, and if we can accomplish it with this device. We always say that it is not a facelift. A true facelift will give you more powerful results. Right. But it involves incisions and cutting of the skin.
Needles, knives, downtime.
And downtime, right.
And probably higher expense, right?
Yes. I mean, I would say that this procedure probably is about 1/3 of what a facelift would cost the patient.
Wow.
Ultimately, if you include anesthesia fees and surgical facility fees.
Right. Speaking of surgical facility, can this procedure, does a client or a patient have to go to the hospital, or can this be done in your office?
Oh, it's an in-office procedure.
Really?
Yeah.
So that cuts down the fees there too.
Oh, absolutely, absolutely. And what we do is we try to make the patient comfortable. We make sure that they have their music of choice when we're doing the procedure.
Nice.
It's almost like a spa-like atmosphere, but
okay.
we make sure that they have their pre-medication on board, so that gets them into a nice phase prior to them getting treatment.
Okay, all right, wow. Okay, well, I'm not convinced that I would do that right now, but maybe later on, maybe as I age, because as we age, our skin drops.
I was going to say, you'd be amazed, Dr. Joy. What's interesting about this is that we have people who are
I'm afraid of the pain. That's what I'm
and we find